Most of you know of the South African sprint runner Oscar Pistorius. We were on the edge of our seats as Oscar Pistorius crossed the finish line to become the world's very first amputee to win a medal at an able-bodied event. Since then, he has appeared in the news for other reasons, but regardless, Oscar Pistorius represents one of the 1.7 million individuals in the United States living with limb loss, according to the National Limb Loss Information Center. Chances are, some of you may know someone with a prosthesis. Prosthetic devices may seem fairly new, but modern technology has come a long way in improving prosthetic limbs, along with providing relief for prosthetic limb syndrome, which is what I will be discussing today. Phantom limb syndrome is a common sensation experienced by about 85% of amputees, and although it is complex, recent discoveries have led to more effective treatments. Phantom pain affects nearly every amputee and is important for us to be aware. Lately, we have been witnessing a rise in diabetes, which is the leading cause of amputation. In addition to diabetic patients, over 600 brave men and women have returned from the Iraq War as an amputee. It is important to be aware and concerned about the struggles faced by those with a prosthetic limb. Today, I will be defining phantom limb syndrome, along with discussing various causes and presenting new, innovative treatments. Phantom limb syndrome occurs when amputees have certain sensations, usually pain in the form of cramping, in a limb that has been amputated. The brain continues to receive messages, so to the patient, it feels as if the missing limb is still there. Another interesting sensation is called telescoping. To the patient, it feels like the limb is shortening slowly over time. There are several risk factors that accompany phantom limb, including blood clots, infections, and possible nerve damage. I have volunteered in the field of prosthetics for the past 2 years and will begin my graduate program in prosthetics this fall. I have talked to numerous patients, and one gentleman I met who was a new amputee shared how he woke up one morning thinking the missing limb was still there, went to step out of bed, and fell down on his stump, which can be excruciatingly painful. Not much is known about the causes of phantom limb, but essentially the brain is trying to reorganize. Surprisingly, a recent study showed that amputees with phantom limb have the same pattern of brain activity as able-bodied individuals. It is evident that phantom limb pain is correlated with remapping of the brain, but which one is the cause and which one is the effect? Treatment for phantom limb can come in various forms. Medications can be taken to relax the muscle and control pain due to nerve damage. Medications are not necessarily always very effective, however. A second possible treatment is electrical nerve stimulation, of which there are 3 types. Transcutaneous electrical nerve stimulation sends an electric current through the skin to points on the nerve pathway. Transcranial magnetic stimulation sends a magnetic pulse to the brain through the skull. And finally, spinal cord stimulation sends an electric current to the spinal cord. Recent studies have opened the door to more advanced and effective treatments. The Department of Neurosurgery at Oxford tested a new theory involving sensory input and deep brain stimulation. Patients reported reduced pain up to 62%. Another promising treatment, developed by Velanayur Ramachandran, a well-known neuroscientist, uses mirror boxes to relieve phantom pain. The somatosensory cortex of the brain is the area that receives and processes signals relating to touch. An expansive network of nerve cells, in conjunction with a sensitive and highly refined somatosensory system, allows us to interpret the world around us. Mirror boxes trick the somatosensory system by providing artificial stimulation. For example, the amputated hand goes into the mirror box, while the other hand is on the side of the box and reflected in a mirror. Because of this artificial visual, the patient can move and unclench the phantom limb, providing relief. One gentleman I spoke with shared how mirror box therapy helped to alleviate his phantom limb pain. Innovative therapies like the use of mirror boxes have made great advances in the treatment of phantom limb syndrome. It is important that we are aware of those using a prosthetic device and the challenges they face. We have defined phantom limb syndrome as sensations of the missing limb, usually in the form of pain. We have also discussed possible causes and treatments. Even though it is complex, further study can lead to more effective therapies providing prosthetic patients with relief from phantom pain.